Chaz McKay on 1560 AM and 97.7 FM KNZR.
It's protocol. That's an inside joke. Dr. Mensink with us this afternoon. When I did a test here a year ago or so, and you said my vitamin D3 levels were low.
Yes. And
you put me on monster dose. What was it?
Massive doses of D3 for a month, and then 50 to 10,000 units per day thereafter.
Right.
And the other thing that's important, if you have low D3s, low levels, under 30, many of these people have essential fatty acid deficiencies. It's very expensive to test for that, but just take what I tell patients, take 2 fish oil capsules daily for the rest of your life, and your D3 supplementation, and you never have that problem again. And it works. It works. Here's some of the neatest things. We've talked about D3 before, but I just thought these are some of the newer things that have come out that to me are just amazing. People with the highest, females with the highest intake of vitamin D3 level reduces their rheumatoid arthritis risk by 44%.
That's amazing. That is amazing.
Here's another thing that was published in Lancet a few months ago. Just 2,000 units of D3. That's not very much D3. 2,000 units of D3, if you're north, above Atlanta latitude, decreases the risk of diabetes mellitus 88%. Now, we don't know why, by the way.
What? If you're north of Atlanta?
North of Atlanta, that latitude north of Atlanta, and you take 2,000 units of D3 daily,
it decreases
the risk of diabetes 88%. Now, we don't know why. Honestly, these are kind of things.
It's bizarre.
Amazing. We all know that reduce D3 reduces
I tell you,
the risk
you know what that is? God's a Yankee.
Oh, my gosh.
That's what it is. He just hates Southerners.
Here's another thing. There's a POMC, or a propriomelanocortin gene.
Say that 3 times
but
fast.
we essentially call it POMC gene. This is in the pituitary gland that essentially regulates, all this a lot of things in the body. It's interesting, but vitamin D3 we now know turns on this gene, and this gene regulates adrenals and cortisol. It regulates immune function and inflammatory process. We didn't know that before.
Wow.
Vitamin D3 increases calcium absorption from the gut. Leukemic cells, this to me is amazing, but certain types of leukemic cells, all leukemic cells, and they're finding most cancer cells also have vitamin D3 receptors. But they've done studies on certain types of leukemic cells with these D3 receptors on them. If you give them high-dose D3, it turns off the leukemic cell and they die.
Really?
Oh my gosh. Now, we don't know why yet. I mean, this is kind of new stuff.
Leukemic cells?
Certain types of, we don't know if all of them do that, but there's been studies showing that.
How many different types of leukemia are there?
I don't know, Jess. I don't, this is, I probably can think of mine about 6, but there are not, I don't know the answer to that. But what we do know is certain types of leukemic cells, it exposed to high-dose D3 literally turns them off and does what's called, D3 is what's called apoptotic.
Is this one of those leukemic cells? Do they live inside all of us?
No, well, hopefully not, because
dormant, but inside.
Yeah, well, no, these leukemic cells, what happens if a leukemic cell occurs because of a gene problem or a DNA repair problem? What happens is that there's really a problem with either genes or with the DNA synthesis repair process. But certain of these genes, or certain of these leukemic cells, we don't know how many or what yet, but certain of them literally will turn off and die and stop multiplying with D3. To me, that's amazing.
That is amazing. That is amazing.
We now know that over 2,000 genes in the body are regulated by D3. These genes regulate 80 different processes, including DNA repair, antioxidant activity. They also regulate cellular differentiation, which means how these cells turn into cancer cells or whatever, and the increased immune function, which you've known for a long time. D3 deficiency now we've known it's associated with depression. And in fact, if you're deficient in D3 at certain levels, between 8 and 14, you literally will not respond very well to the serotonin agents or the noradrenergic agents. But we also know that there's association, we don't know how much yet, with schizophrenia, neurocognitive decline, Alzheimer's, seasonal affective disorder, and Parkinson's.
Wow.
This is sort of mind-boggling. All these neural things.
Now, these discoveries have just recently been made.
Just coming out in the last year or two. And the other thing that we've known, or that is coming out, is that obese people and people with fat malabsorption problems have trouble absorbing D3. Now, the last thing, this is to me this is just amazing. And it's too early to say, you can't say that D3 will cure cancer. That's not what we're saying here. But here's what we do know. If your level of D3 is between 40 and 60, it decreases your cancer risk by 60%.
Wow.
That's wow. And we have studies showing that it helps prevent pancreatic cancer, ovarian cancer, prostate cancer, and skin cancer.
Amazing.
It's amazing. If it was during the summer, I'd tell you, get lots of sun. During the winter, you need UVB, maybe a sunshine.
What people need to do is, honestly, here's what I would recommend. I'm going to recommend now.
Let's
Doc.
hear this.
I recommend you get that slip from your doctor for the PAL. Go get your blood test done.
You said, Jazz, you just hit the nail. I'm a strong believer. Get your blood level done.
Right.
And get the doctor to look at it.
And assess the D3 levels.
Just think
among other things.
Think of the amazing things that can happen in your body. The amazing things that can happen if you correct this deficiency.
Yeah.
Now, I saw a gentleman this morning who is depressed, and he's not responding well. His D3 level is 10.
Wow!
Right?
Oh my God!
And this is just
now normal is what
30 to 100. In fact, there's some studies suggesting, and probably in about 2 or 3 years, there's some people who want to change the normals from 50 to 150. But that's really that's out of the box right now.
Right.
But this man is depressed as all get out, and if we don't correct his D3 levels, he will not get better. All right, when they're that low. And it's something that we as doctors, we're starting to think more and more about. And I think it's fantastic what's happening in the medical community because doctors they're cluing in. Now, we tend to be in the practice more aggressive with this than most, but it's phenomenal, the changes we see with patients when they have this is looked at and corrected aggressively and where they can go from there.
Oh.
And it's amazing.
So whatever you do, folks, make sure that at some point here, make this a New Year's resolution to get the blood work that's necessary to make a diagnosis on your D3 levels.
Yeah, very good.
And get her done.
Yeah, from Dr. Jazz.
Yeah. Thank you, Doc. Thank you, Doctor. Yes, Doctor. Hello, Doctor. Hi, Doctor. Call the practice, by the way. It's 871-3300. 871-3300 is the phone number. Make an appointment. Go in, check it out. The practice, it's a whole new form of medicine, prepaid family medicine. So many different programs. We're not going to go into them all right now, but you can certainly have them all explained to you by dialing 871-3300 for the practice. 871-3300.
Yeah. Happy New Year, everybody.
Happy New Year to you, Doc. Good to see you.
Okay.
Think of the practice like a doctor from 50 years ago. No long waits for appointments. 40% of our appointments are seen same day. No rushed appointments, and access to phenomenal amount of discounts. We have the time to do good medicine. We're also focused on the emotional, the spiritual, dietary. All of those things feed in. We do more than most urgent cares do because we have the expertise, the skills, and the equipment to do it. We're able to do that top quality medicine, have that phenomenal access for less than a cup of coffee a day.
I joined the practice for a number of reasons. One, I knew Jan Mensink for many years. He's a superb doctor, and I have appreciated his expertise in other areas. It's very affordable. Medications, he's worked out deals with pharmacies. One medication I get for free, it would cost me $300. What I like best about the practice is the availability, accessibility. At times, I'm able to get in 2 or 3 hours. They deeply care about their patients here in an extraordinary way, which is unusual in today's modern medicine in most places.
My husband and I joined the practice 3 years ago. We could not afford medical care at the time. Not long after we joined, my husband had a spider bite and he got very ill within a day. I was terrified that we were going to have to put him in the hospital, which I knew we're looking at $40,000, $50,000. We brought him in and Dr. Mensink saved his life. We were able to come in here every day without any extra charges. I love Dr. Mensink. He's wonderful, and I will never ever forget how Dr. Mensink was with us.
My family and I have been members of the practice for the past 2 years. I joined the practice because I wanted to find a place where my family could be treated without taking a lot of time. But what we like about the practice is that if our kids are sick or we're sick, we need medical attention, they'll take us usually the same day. They treat you very well. It's not very expensive, it's affordable. I like that the practice is always there for us. Nos unimos con The Practice para que nuestra familia tenga muy buenos, eficaces doctores. Nos gusta mucho porque si uno de mis hijos está enfermo, nos meten de forma inmediata, por lo general el mismo día.
Lo que más me gusta de Practice es que hablan mi idioma.
Es un plan muy económico y que atienden a uno muy bien. Lo que más me gusta de The Practice es que siempre están ahí para mi familia.
Cuando llegué a la oficina y vi al doctor Mensink, yo llegué y me sentía débil, muy débil. Yo había visto muchos doctores y no me arreglaban el problema. Pero cuando llegué aquí al doctor Mensink, él me hizo un chequeo, un examen completo y encontró el problema y me ayudó, me dio el tratamiento que necesitaba y ahora me siento con mucha energía y estoy muy contento aquí. Él es un excelente doctor, estoy seguro que les dará ayuda tal como lo hizo conmigo.